Hookworm, as I explained already, therefore utilizes blood, and there's a direct linear relationship, more or less, between eggs per gram in feces, which is a measure of worm load, and then increasing blood loss. So all of us, therefore, will lose a small amount of blood, the negative ones, but as the worm loads go up, so the eggs counts increase, you therefore get more blood loss. And therefore, a woman in Bangladesh who weighs on average 50 kg and harbours a fairly average load of 250 hookworms, her iron stores will last a matter of only 2 months. She will become therefore extremely anemic in quite a short time. So once you deworm them, what happens? These are Indonesian data. Within, as you can see, a very short time, there's a dramatic improvement in appetite, and therefore there's a change in weight gain. In 3 weeks you show it, and even more show after just a mere 7 weeks. In Bangladesh, we've done lots of work there. We did one study over 18 months looking at the impact of different types of deworming and health education. I found that a child who had 6,000 eggs per gram, which got a modest load, compared to a child who didn't have any eggs at all, was over that period, you can see, just under half a centimetre taller, or shorter, depending on what you're looking at, than a person free of the infection, and weighed 2 kg less. Extrapolate then from a mere 18 months study to all of childhood, you're talking then about 3 or 4 centimetres you've lost, and also 14 kg in overall weight. Dramatic effects therefore of this. There are 7 things which you can associate poor nutrition with. Those are the 7. I'm not going to discuss all of them in detail today. But I do want to focus on a few of them, some of which you might know about, some which you might not know about. And first of all, I want to focus on low birth weight. Now, what you might not realize is that low birth weight is not something quite often you can overcome. And we have some very good data from America which shows that even in a well-nourished country like America, these are data from Ohio, if you compare low birth weight babies with normal birth weight babies, that's NBW with LBW, you can show at the age of 20 that there are significant differences between those groups. So especially for males, you can see a deficit in terms of height of 3.3 centimetres, and they are between 2.7 and 10.7 kg lighter. So there's evidence there that a child who's born with low birth weight does not catch up. It's something they've got for life, unfortunately. There's also further bad news, I'm afraid. If a child is undernourished, this is the so-called fetal origins hypothesis, there's a very good risk that when they reach adulthood, they will show increased risk of showing from coronary heart disease and various types of diabetes, so-called type 2 non-insulin types of diabetes. And also if you're born not with low birth weight, but on the lower edge of that, there's again a strong association. So people who are therefore not down to the low birth weight of 2,500 grams, but on the lower levels of that, they will also be associated with some degree of increased coronary heart risk or type 2 diabetes. So if you like, a double whammy there for this. You've got low birth weight, you might not catch up, and also you've got increased risk later on of suffering from diabetes too. In Bangladesh, it has the highest levels of low birth weight in the world, some 40%. And we as nutritionists now think of life in terms of a nutrition cycle. Starting off, as you can see, with a low birth weight, and then for the reasons I just showed you, because of inadequate feeding, they get mucosal damage, they become stunted as a child. That will then persist through adolescence, and for women they grow up being small, which means that the likelihood of them having a low birth weight baby therefore increases. You therefore get this vicious cycle of continuing intergenerationally combination here once more of poverty once more and undernutrition. Even if they are born as a normal weight, what happens thereafter? This shows you here the global picture for weight for age, WA, length for age, and weight for length. It's measured here as length because for the first 2 years we measure children by length rather than by stature. As you can see, there's a downward trend here from birth going downwards, and they reach a nadir here at about 2 years. This sudden hike here is just caused by the change from measuring length to height. If you measure somebody's length, they're longer than if you measure their height, because of course they become slightly shrunken because of it. So all these therefore showing a downward progression, except perhaps for weight for height, which shows some slight gains the first 3 months, maybe due to intrauterine growth retardation effects, and then they're on the downward trend. That's the global picture. This is based upon 39 countries worldwide, Sample size is well over 500,000 children. If you then start looking at them individually by area, based on Africa, Asia and Latin America, you can again show that Asia shows the highest levels of wasting and stunting and underweight. So by the time a child reaches 5 years of age, they're basically damaged for life. This is some very good data from India, showing here on the left-hand side children with various degrees of stunting. They're all stunted, so between 0 and 2 SDs and 2 to 3, etc., going down. And these children were measured at the age of 5, and then they were then re-measured, the same children, some 12.5 years later, when they were 17.5. Now what you might hope to happen, of course, there would be some type of catch-up, whereby those who are very stunted here would therefore have gone up and joined their colleagues here. But you can see here the differences here are very similar to differences here. Therefore, the overall growth, therefore, is very similar indeed over that period. So basically what you're saying, therefore, that all groups have just all moved up parallel. They haven't, in fact, shown any catch-up. And in fact, the increase that they've obtained, overall 62 centimetres, is very close to that of children from the USA in that same time period. So deficits of 5, therefore, just persist onwards. They do not, in fact, gain in any way at all.